I do not recommend getting braces on one jaw most of the time. Currently, we are 13 orthodontists in Kenya. An orthodontist is a dentist. However, a dentist is not an orthodontist. Sucking of the thumb of a child affects the jaw formation. The youngest patient I've had was like 6 weeks old. Growing up, I realized I was good in the sciences. I trained in Europe and I was based there for 18 years. I studied for 13 years. The first couple of years I trained to be a nurse, then I trained to be a dentist, and at the end I trained to be an orthodontist. My name is Dr. Wanjiru Stuhler. I am a specialist in orthodontics. I'm based in Kenya. So my journey started with the opportunity to go to Germany. The opportunity did not entail going to university. That was just a goal I had in my head, which I managed to realize it 4 years after being there. So currently we are 13 orthodontists in Kenya, and we mainly focus on moving teeth and moving jaws. The youngest patient I've had was like 6 weeks old. Sometimes I have patients, the teeth, they only have 2 teeth in the whole mouth touching because the whole jaws are totally misplaced. So I work with the surgeon, we bring the jaws to the right place, we bring the teeth to the right place, then they can chew. The tooth is the only organ on our whole body that does not regenerate. You lose an eyebrow, it will grow back. You get cut by a knife, a scar will form, but the wound will close. You lose a tooth, it's gone, and it's gone forever. So I would be very, very careful about losing teeth. So sometimes I hear a patient comes, daktari nitoe meno inaniuma inanibo. I would always try to keep that tooth. There are some teeth, they've gone too far, and they have to be removed. However, most of the time they can be saved. An orthodontist is a dentist. However, a dentist is not an orthodontist. You have to first become a dentist before you become an orthodontist. So depending on how much orthodontics a dentist does, they can do some procedures. The recommendation is, however, to go directly to the orthodontist to get the specialist treatment. In Germany, for example, specifically, once you're an orthodontist, you do not do any dental work whatsoever. This concept, we are trying to get it into Africa. If I see a stuck wisdom tooth, the third teeth, you know, the ones that get stuck a lot, I can see it in an x-ray and I know it needs to be out. So I will refer to a surgeon to remove it. So the same way it's supposed to work vice versa. When a dentist sees the teeth are crooked, they're supposed to ideally refer to the orthodontist to straighten them up. The age that I recommend to see the orthodontist the first time is at around 6-7 years, because this is the age the new teeth start coming in. Baby teeth actually fall off on their own, and when they don't, there is actually a problem. So you're supposed to shake them and let them drop. So these scenarios of tying teeth with strings on doors, that's a no-no. Sucking of the thumb of a child affects the jaw formation during growth. That is why I recommend, as soon as the first molars come in, you see an orthodontist for a habit breaker appliance to be made to stop the child from sucking. Because dealing with thumb sucking habit 6, 7, 8 is way easier than a 13, 14, 15-year-old. I offer virtual consult, and I also give the patient an idea of what it's about. We already limit who comes to the office because I can already tell the difference of who needs to start and who doesn't need to start if I virtually look at them. In our orthodontic field, we have clear Invisalign. These are braces that are colorless, and you can put them in and remove them yourself. So they move teeth within time without having the typical braces that everyone knows about. So what happens is we scan the teeth, yes? The scan is sent to the lab. The lab fabricates such aligners. The first time the patient comes, I fit it in, yes? I give the patient maybe 4. I ask them to wear 1 aligner per week, every day for 22-23 hours a day. As soon as you remove, you can brush your teeth easier than with the conventional braces. However, as soon as you remove, your teeth stop moving. I do not recommend getting braces on one jaw most of the time. You can have straight teeth on one jaw and only crooked on the bottom, but I will still recommend both jaws because I want to make sure that I coordinate your bite at the back. So our wires, our aligners, most of the time straighten the teeth. However, the correction of the bite at the back, that is done by the patients themselves by wearing the rubber bands. There are many ways to whiten teeth. There are home kits. There are those kits you do them at the dentist. If you're doing it with the dentist, the concentration will be higher because this is a medical product and the dentist is monitoring how you're doing it. If you're doing it at home, you're buying products from the chemist, the concentration will be low and the efficiency lower. However, they still work to a certain degree. So if you want extensive whitening, it is better to see the dentist for it. I recommend seeing the dentist twice a year. At the end, it's also more affordable and more efficient. You go, you pay consultation twice a year for 10 years without ever having a cavity, or pay for a crown 10 times the amount you'd have paid 10 years. Are you getting the math? Yes. So I recommend seeing the dentist regularly to make sure the teeth stay healthy, taking your child to the orthodontist from the age of 6, and getting things done before they escalate. There's also a misconception, orthodontics is aesthetics. Yes, there's an aesthetic factor. If you have nice straight teeth that don't have spaces and they are not crooked, it's aesthetic. However, a lot of times it is actually not an aesthetic consideration to do orthodontics.